I am Jillian Mason,
And I am Benjamin Day.
and this is the Medicare for All podcast, the podcast for everyone who needs healthcare. How about you, Ben Day? Do you need healthcare this week?
God, I need healthcare every week. Sadly, I've reached that age where everything's breaking down a little bit. So it just depends. The week, the body part changes by week, but yeah, I'm
Yeah.
in constant need of healthcare basically.
The funny thing is that you have been saying I'm at the age now where
Mhm.
I start to have health problems every day, and I have gout, and I have lots of old man diseases. You've been saying this for about 15 years now. I'm just going to clock that.
It's true. It's true. Many of them have been with me for quite some time now. I've got the arthritis in my back. I got arthritis in my shoulder. I've got the gout.
Ooh.
You know,
Mhm,
I've got
mhm,
things that will
mhm.
not be described in detail on this podcast. Uh,
Great, great.
I hesitate to even ask you whether how your healthcare needs are going because sometimes we get stories that shock me.
It is really funny. I do try to impress you, because like
Yes.
you spent like a good like what, like 15 years of your life, the whole 15 years you've been talking about being old with me. You spent about 15 years of your life doing healthcare work, right? So you've heard from people with a lot of weird healthcare stories, but
Hmm.
mine kind of are weird, right? Like they kind of are a little shocking maybe sometimes.
Yeah, yeah. I mean, I guess you're not like a crazy outlier when you think
No.
about all the stories we hear. But it's always just shocking when somebody you know very well ends up with these stories. It's like, oh fuck, it's like it lands home harder, I think. Um, yeah, and you do have some weird ones. You have some really weird ones. Yeah,
Yeah, I think that they tend to be not like the worst we've heard, but like just kind of
yeah,
weird, a lot of weird Texas
hmm
shit. I don't know. Anyway,
yeah.
I'm fine this week, and I'll tell you why.
Good, good.
Because it is a good week for Medicare for All, Ben.
Oh, excellent.
So last week, we had our Medicare anniversary day of action. Medicare turned
Hmm.
61 and we all
Right.
celebrated. Went out to representatives' houses. Houses. I keep calling it their houses, but really just their offices. We haven't gone that hard yet. But I look forward to that moment when we go to their houses.
Yeah, yeah.
So we went to reps' offices and we reminded them about how cool Medicare is and how cool it would be if we
Hmm.
had Medicare for all. I got mild heat stroke and have been sort of on and off sick ever since. But the news about Abdul El Said winning the Senate primary in Michigan has been enough to
Hmm.
carry me through this week.
Yeah, that's hot news. It's
It is hot
national heat
news.
stroke. Yeah, yeah.
Okay.
I I was humble bragging to my wife yesterday when he won the primaries. I was like, I know him a little bit. You know,
Oh,
I
yeah.
took out
Yeah.
his Medicare for All book, and I've got a little blurb on the back, and I was like, hey, look at who you're married
Oh,
to
you
here,
did.
a blurbist. Yeah,
Oh, I forgot that you had blurbed him. Yes,
I did. Yeah,
absolutely.
I read
Yeah,
the
you
whole book as a PDF file before it was published. It's actually a very, very good book. So,
yeah, yeah, yeah. He's a pretty great guy, I think.
mhm.
And actually, it's interesting because later on in the show, I'm gonna show you an interview that I did with Carrie Rheingans. She's a
Okay.
state representative from Michigan, and she is
Mm-hmm.
leading the other Michigan Medicare for All fight you might not have heard
Awesome.
about. But her kid is also friends with Abdul's kid, which is really cute. Like her
Okay.
child was like super invested in making sure that her friend's
Hmm.
dad won. It was really cute.
Awesome. And I have a real stake in this because most of my family is from Michigan originally.
Oh.
I none of my grandparents are alive anymore, but they all lived in Michigan, mostly in the Kalamazoo area.
Mhm.
And actually, there is an illustrious. So my mother's side of the family is named Hilberries, and there's an illustrious Hilberry dynasty in the Michigan area. My great grandfather was the president of Wayne State University when he converted it from a private university into a public university. When the fuck does that happen anymore? So, and
Wow,
and he,
wow.
and he was a Shakespeare scholar, so go figure. Um,
That is
but
well,
anyway,
The English departments are always the most radical. I will say that.
Yeah, yeah. Okay, fair.
As a former
Especially the
academic
repertory
myself.
theater. Yeah.
But yeah, so we're pretty psyched for Michigan. It's been pretty
Mhm.
good, which is it's been a bonus because there's also some not so great healthcare news that we should probably talk about. You into that? You want to talk about some
Bad healthcare
healthcare
news on the
news?
podcast? Yeah, oh, that doesn't happen. In the Trump era?
In the
All right,
Trump.
let's get through it. Let's get through it because it is important. Obviously, this is what's happening in people's lives right now. So
No, we got to document what's going on here to a certain extent, right?
Yes.
Because like it's like you know, a lot of these news stories that we cover are, you know, some of them are things that end up on, you know, John Oliver or whatever, or some of them end up on the front page of the newspaper, but for the most part, they're covered by Axios. They're in Reddit forums. They're in Kaiser Family Foundation reports and stuff like that. So they're just, it's like, this is the experience that you're having in your life, and the only people who are talking about it in the media are a bunch of fucking nerds, you know?
Oh, I thought you were going to say us.
Oh, yeah.
We're not in the media, I guess.
Same difference. Still a bunch of fucking nerds. Anyway, so let me try to be less nerdy while I talk about this. Shit's fucked up, Ben. Shit's fucked up.
Yeah.
Millions of people are losing coverage for two major reasons right now that I wanted to talk about. The first is that hospitals are seeing a huge increase in uninsured patients since the ACA subsidies expired. Right? That's something that I think we all could have, you know, predicted.
Who would have known that when you cut people's health insurance, they become uninsured?
Yeah, that's interesting. It's interesting when you put it that way. You have a certain clarity about you. Yeah. Oh, you have no insurance. Oh my gosh, that made you uninsured. Yeah. So I guess the thing that interested me, and so apparently it's up by like 20%, the number of people who are coming into hospital emergency rooms uninsured. And we all know the follow-up from this, right? It's like, if you don't have insurance, you're going to put your healthcare off for 1,000,000 years until you're desperately ill. And then you have to use the emergency room. Because of course, you know, the emergency room is required to provide you care for emergent situations, right? So people just, you know, wait up. And I've totally been in that situation and I fucking hate it. Do not love it. But what's interesting to me about this is that Times did a really good piece on the increase in uninsured patients, and they interviewed a bunch of people from different hospital systems. So there's this one woman, Laura Kaiser. She's from SSM Health, not S&M, SSM Health, which is like a nonprofit Catholic hospital group. So, you know, whatever. I mean, you know, she's probably like only marginally evil or not evil at all. I don't really know. Laura, I don't know you. Reach out. So the point is that she sort of commented on these for the Times reporter, and she said, what this tells me is that there are patients who are completely unable to pay.
You really hit the nail on the head there. Yeah, I'm glad we have experts out there for things like this. Yeah, I was struck by you were talking about the Axios article, and bless the Axios reporters. They actually listen into the for-profit hospital chains, like their earnings calls. You know, they're like investor calls.
Yeah,
and they had in the CEO of Hospital Corporation of America, again the largest for-profit chain in the country, had this quote: "We expected some of these patients to shift to other forms of coverage, but this did not happen. Instead, these patients migrated almost one for one to uninsured."
I'm sorry.
I think the lesson here is that they're migrants. Yeah, really, they're immigrants.
Boy. Yeah. And everyone's so super surprised about this, but I guess I do appreciate the fact that Laura Kaiser, she, you know, once she said, this tells me that there are patients who are completely unable to pay. Brilliant insight. She says, we're really crushing people who are desperately trying to pay their bills. The hospitals are absorbing that, and we can't. So essentially,
shed some tears for the hospitals is really the lesson here. Yeah.
Right. So we've got like millions of people, like a 20% increase in people coming to the hospital uninsured, right? We got millions of people losing their healthcare, delaying healthcare, and not, voluntarily like Lindsey Graham did when he decided to go on Meet the Press instead of getting a doctor's care and died. Involuntarily, people are going without health care, and and then the hospitals are concerned they've lost some revenues.
Yeah, and I think it's worth reminding people why these are the enhanced ACA subsidies. I feel like we're getting into weird language and acronyms altogether, but basically this was like the marginal improvement of coverage under the Affordable Care Act in the marketplaces. And this was passed in 2001 for the American Rescue Act, and then it was extended a little bit in 2002 with the very poorly named Inflation Reduction Act. So basically, these were COVID measures, right? This was during COVID when everyone was like losing their jobs, losing their health insurance, and it was just obvious people couldn't pay. Yeah. And I have a theory, which is that I think a lot of our country is kind of perpetually in crisis, including a healthcare crisis, but also housing crisis, food crisis. They're all kind of interrelated with one another. But every once in a while, a disaster comes along that like extends that crisis situation to like people with a little more money, a little more influence, and suddenly it becomes we have to cover everyone, and they start doing all the things that we've been asking them to do. I'm going to give you two examples aside from this one.
Okay.
One of them was after Hurricane Katrina.
Mm-hmm.
Everyone lost their homes, and with that, they lost a lot of like their documentation, like birth certificates, ability to show when they were born, that they have citizenship status, all that stuff. So when that happened, both the state and the federal government waived all of the Medicaid determination requirements. You didn't have to prove that you were basically you could just sign up for Medicaid if you needed it.
Right.
So it was like a weird statewide like Medicaid for all. And then they did the same thing in 2010. This was the weirdest but kind of most interesting example. When they passed the Affordable Care Act, there's a little known provision where they basically gave Medicare for all to one town in Montana. It's Libby, Montana. They waived the age requirement to enroll in Medicare. So you didn't have to be 65. Everyone in Libby, Montana got Medicare. And this is because they had this huge vermiculite, like asbestos mine, and it covered the whole town it was like the biggest public health disaster, probably maybe in the I don't know, I'm probably overstating largest public health disaster in the history of the country, but it was huge. It was declared a national public health emergency. And they decided the way to deal with it was to give everyone in Libby, Montana free health care, essentially, under the Medicare program. So again, I think it's just like, as soon as there's a crisis that extends beyond people who are already in crisis for decades, it's like, oh shit, we have to do a universal thing, right? We can't have all these, documentation requirements and income requirements and age requirements getting in the way of people getting the care they need. And suddenly they're ready to do the right thing. So anyway, this is my theory, and they did something. The ACA subsidy expansion. It wasn't not nearly as big as those other two, but it was like a COVID oh shit moment where it's like we have a national crisis now. We know people can't pay for health insurance. Yeah. We've got to do something different here and start waiving these, being more relaxed with like how much people can afford with the premiums and how high up the income scale we're going to offer subsidies for.
I mean, I think you're, very much right about that. The cynic in me says that the real issue is when white people start suffering. When the particular genre of white people who politicians care about start suffering, right? I don't know. That's
Are you saying Libby, Montana is white?
Wow. Wow. Do I want to make a wager on this? Do you know? No, but honestly, kudos to whatever senator or rep got that one inserted into the ACA. And we should really check in. If you're in Montana, tell us about your adventures in Libby.
Libya, Montana. I expect it's expired by now, but
Sure.
it was a thing for a while. Yeah, it was
We
the
can't.
only Medicare for all town in the country, in the United States. So
I really love that. And yeah, fun. Thanks. Story time, Ben. I love it.
story time. Yeah.
Story time. Here's another story about people losing healthcare. The second big reason that people are losing healthcare right now has to do with the Medicaid work requirement story that we've been following pretty closely. You guys will recall that our regular listeners will remember that we had talked a few months ago. Like last month. Oh my God, time flies. We talked like last month about the fact that the Center for Medicare and Medicaid Studies had put out a request for comment about Medicaid work requirements. They said, you have until July 30th to get your comments in about our new policy, which is that we're going to kill all the poor people if they can't prove that they've done 80 hours a week of volunteer work. So they asked for comment by July 30th. And they also announced at the same time that they would be instituting the policy on July 30th. So as you pointed out at the time, Ben, that was a little confusing. Very difficult to believe that they are taking your feedback seriously when they are instituting, when the deadline for submitting comment and starting the policy are the same. They got a bunch of responses back, and many people, they were concerned that the disability and illness exemptions are inadequate, right? So, of course, the rule, right, the proposed rule would have provisions that would make exceptions for people who have disabilities and chronic illness. But, folks were really concerned that maybe, they were not adequate to actually cover people who really, really need Medicaid. The American Cancer Society recently responded to this. They had a survey that showed that 90% of cancer patients and survivors said they had to miss work, school, or volunteering gigs as a result of their illness. Obviously, that's a commentary on the fact that maybe you shouldn't be forcing people to
work.
Just saying.
Yeah.
And then 3/4 of the people who commented said it would be hard to successfully submit paperwork to provide that to prove that they worked or get an exemption during treatment. So people were having some trepidation, and then Nebraska actually became the first state to start cutting people off this week.
God,
and they did.
I was looking at this, just kind of some of your notes on this story, and I for a moment I thought I had, just recently read an article about this, where work requirements had become way more burdensome. You had to provide all this documentation, and people were falling off the program, not because they weren't eligible, but because they couldn't make it through the documentation loop. So there's like a Kafka-esque experience where you can't get an appointment without, first having called a phone line. But if you call the phone line, they say you have to schedule an appointment, and you can't get a hold of a person. And if you walk to the place, they're like, we won't see you without an appointment. But it turned out this was actually the story about food stamp, which the same thing is kind of happening, where they are increasing these work requirement burdens for food stamps. And the story was about Arizona. And yeah, it's like a double attack on just kind of the real core essential human needs and human rights. The story was so similar in its shape that I misremembered it as like a Medicaid work requirements story instead of a food stamp story. And the food stamp cuts are moving along a little faster, actually. But I think we're going to start seeing more and more of this with the Medicaid cuts as well, which is going to be the same thing. It's not even, most people qualify for this, are eligible for it. It's just going to be creating these administrative burdens that people fall through the cracks, even sometimes when they're doing their absolute best to meet all the requirements. So it's really fucked up.
Yeah, no, I mean, it's just a massive, massive clusterfuck. People are really, public health folks are really nervous about what's happening in Nebraska already.
Right.
Yeah, I'm interested in learning more about the story of how Nebraska beat out Arkansas, because Sarah Huckabee Sanders was really pushing hard to be the first state to kill their poor people.
Yeah. Famously blue states, and they're really sticking it to the blue states again here. So.
Yeah. They've done a lot of. I think we talked a couple weeks ago about the payment freezes in Minnesota and everything, and everything is an opportunity to take revenge, of course, in the Trump administration. But so here we are in the middle of a time when millions of people are losing their healthcare coverage. It's documented that it is having effects, right? Because the Trump administration always claims that their cuts are actually really just eliminating fraud and abuse, right? Like they want you to really believe that, like, $1 trillion of Medicaid needed to be cut because there were people who were bilking the system. But so we have documented proof that this actually has real effects on people who were not bilking the system.
You may not know this, Jillian, but if you are uninsured and unemployed, it is fraud for you to try and get health insurance coverage.
Yes. Yeah, they're going to take away, like Citizens United, they gave corporate personhood to the corporations. They're going to take away our personhood if you're unemployed and don't have health care. Oh, yeah, actually, you know what? They are taking away our personhood. Again, this goes back.
Is that a metaphor for being killed? Taking away your personhood?
We say unalived now. Yeah, it's the educated person's unalived, taking away your personhood.
Unalived. Okay.
Oh my gosh. So in the middle of all this, one of our good friends decided to pipe up and do something about it. And that guy is Senator Ron Wyden of Oregon. Do you remember him?
I do, and I should say he's good on some other issues, but he is really shit on healthcare from a Democratic perspective.
Yes,
within the Democratic Party. Yes.
Yeah. So he's a Democrat. He's the ranking member of the Senate Finance Committee, and he is just like a notorious healthcare douchebag. You're right. He's good on a bunch of other issues, but this is for some reason like his favorite thing is like licking health insurance company boots. And so he, folks might remember him from 2006, and I say that knowing that no one remembers him from 2006. But he did actually have his own healthcare plan in 2006, right? As we were like kind of entering into the Obamacare debates. And his plan was pretty revolutionary, Ben.
Okay, hit me with it. I do not remember this. I think I was hired in 2006 to my first healthcare job. So somehow this one passed me by, but
yeah, it's okay. I didn't remember it from the time being either. Although I actually here's the deal. His plan was that we should privatize. We should come up with a system to comprehensively regulate private insurance and replace Medicaid and Medicare with private insurance.
Oh, I mean, sadly, it's already being done in a way, but through privatized HMO type implementation systems and Medicare Advantage. But I'm guessing that's not the way he was planning to do that. So.
No, not cool, dude. Not cool. But as the ranking member of the Senate Finance Committee, he is taking on healthcare, and he put out a request for information, an RFI, if you will, which is basically like an invitation for comment. This is sort of like it's sort of like when we were talking about the Medicaid work requirement rule. It's like the comment period where people can actually submit comments. So they're looking for comments from experts and ordinaries. And so there are going to be a lot of different ways to plug in with this, but he put out this request for information, and specifically he wants information about 3 different areas. He wants to talk about reversing Republican cuts and reimagining a better path, making healthcare simpler for families, and taking on corporate greed.
Mm-hmm.
And yet he is against Medicare for all. What the fuck, right?
Yeah, I mean, that's kind of like those 3 talking points are Medicare for all.
I
mean, what could
know.
simplify healthcare more for families and eliminate corporate greed, other than kicking out the corporations?
It just like, it's so funny to me when they like sort of take our talking points, you know what I mean? Like, so like,
Yeah.
I'm like, when I like look at it and I'm like, oh, take on corporate greed, make health. Yeah, this sounds great. Yeah. Right. Reimagining a better path. Fantastic. And then I'm like, you have seen the exact same problems that we see every day and come to the exact opposite solution.
Yeah, I think I'm remembering David Moyer was this like social movement thinker. He was like trying to lay out the history of the steps that social movements go through on their way towards victory. And at some point, one step is that your opponents try to co-opt all of your language because they realize they can't use their own language anymore. And I think at least within the Democratic Party, that has happened for quite some time now, where the term universal healthcare used to belong to the single payer movement, to the Medicare for all movement, but that's been co-opted even by people who don't actually have a plan that would make healthcare universal, and along with it, a lot of our other language.
Really disappointing. But this is not a statement of Ron Wyden's beliefs. This is a request for information. So it makes it sound like he's willing to listen. So we're going to be working with a bunch of people who are going to be putting out, talking about different policy proposals and why Medicare for all is the best one. And we're going to be giving folks opportunities to participate in this. Our listeners directly, you'll be able to participate in this as well. So stay tuned for that. But it opens up an opportunity to talk about healthcare, and we love it, right? We love the opportunity to wrestle with corporate Democrats about where our values are, right?
Here's how I read this move, this RFI move. So you may have noticed the Republican Party doesn't really even have a health insurance plan anymore.
Right.
And I think Democratic centrists have run out of ideas as well. Right? We've cycled through, I mean, they've been a bunch of different options of the public option. There's, variations on the Clinton plan where you force people to buy insurance but subsidize them, and then you keep the employer-based and, the patchwork effort. I mean, I think this is, to me, this is a scream for help. Help us find another centrist way. Help us find a non-Medicare way forward, because we might be in power next year and we're going to need something to show that we're going to do that's going to be better than what you have, and that hasn't already been disproven over the last decade or so. So yeah, I think we're not going to give them the answers they want, but we're going to give them the answers they need.
Yes, very much so. I mean, you're absolutely right. They are. You're absolutely right, Ben. You're absolutely right. No comments, no notes. Oh man,
that's what I like to hear.
No notes. So I did want to bring up one story that I thought was fun, like a fun story before we head off. You want to talk about fun? This is not actually a fun story.
I was going to say, what's your definition of fun?
I don't know, Ben. I don't know anymore. I don't know anymore.
All right, hit me with it. I'm ready. Go ahead.
Oh my God. All right. So The Guardian did an amazing report on an article that you should all go out and read. It was a study of AI-generated doctors on TikTok.
Oh, okay. All right. All right. This is a little. I mean, it's probably going to be really bad, but the idea of it is fun. What was it? What happened?
So basically, they found that there's been a rash of folks who have been generating AI videos with avatars that
Mhm.
look like doctors or wearing a little white
Right.
coat.
Mhm.
They are giving some pretty dubious medical advice. And honestly, I really just needed to bring up this story because they reported on this one specific thing that I thought was amazing.
Okay.
This is from the Guardian article. The accounts also promoted bizarre remedies for various health problems, including Coca-Cola mixed with onion as a pain relief remedy, and a fake product called Hyalothinap Plus
Mhm.
Pro Max. Hyalothinap Plus Pro Max as an anti-aging solution. Now, I would
Mhm.
be apologizing that maybe I was pronouncing Hyalothinap Plus Pro Max
But
incorrectly.
it's fake.
Turns out, yeah. So this Dr. Avatar gets on in the video, right? And he says that he has
Mhm.
recommended
Right.
Hyalothinap Plus Pro Max to his patients for years, and that it could fight hair loss, skin weakening,
Mhm.
brittle nails, and joint pain, and
Right.
help the body to produce anti-aging molecules naturally. And then
Mhm.
the Guardian caps off this little summary by saying, the Guardian could not find evidence of a Hyalothinap Plus Pro product Plus Pro Max product online.
Mhm. It's age maxing. That's what it is.
Age maxing.
You know, the funny thing though, as I listened to that, was like, is it any worse really than something health advice you might get from RFK Jr.?
I mean, honestly, no, right? Like, I mean, it's like, right? Like,
At
is that
least you'll look
crazier
into
than
it,
beef
you'll find
pills?
it's not real. Yeah, that's relatively
Yeah.
harmless.
Yeah, that's true. As whereas if you look up like one of RFK Jr.'s positions, you'll
Right.
find like a million fake experts like pretending, whatever,
Right.
or lying for money.
Right. Right.
So yeah, I don't know. I just think like I'm interested in the AI doctors story
Right.
for a couple of reasons, but one of them is just because I think it points to the cultural impact of our for-profit healthcare system, which is that it fucking corrupts the relationship between people and medicine, right? Like it just corrupts it completely. Everything is up for grabs. Everything is, is something, you always have to worry if someone's giving you health advice, if they're doing it for money, right? Like, it's fucked us all. It's fucked us all. Like, we would not be in this situation if we had not gone so far down the road of letting corporate interests control everything to do with our healthcare. I'm just saying.
Yeah. It's true, and I think a lot of people are drawn heavily towards alternative medicine because their experience with the standard healthcare system has been so bad.
Yes. Yeah.
Which, I mean, I don't mean to be really trite and dismissive there, but I think that is the dynamic. And yeah, I mean, I was also thinking like it's actually an AI bot that's giving you wrong information, but they're not selling a real product, is refreshing compared to like Dr. Oz, who is
True.
selling you a real fake product that he's being paid to peddle. So
no, that really does track. Yeah.
Yeah.
AI doctor selling fake product better
Right.
than Dr. Oz. It also just illustrates maybe some of our people who are better at navigating the algorithm than me can help me understand how you monetize a fake advertisement for a fake product.
Right. I don't know. Maybe it drives up your view rate, and therefore you can show ads. And I don't know. There's got to be something going on there.
Any engagement is good engagement, which is why I'm psyched that I'm actually looking here at some of the YouTube comments coming in, and I got "we don't care" and "ha ha ha noobs." I don't know if those were directed at us, but again, keep the engagement coming.
Yeah.
Yeah. So you know who is not an AI doctor though, Ben?
Who's that?
Dr. Abdul El Sayed, who we mentioned previously.
True that. Yes.
And so, yeah, I thought maybe we could wrap up and I could show you a little bit of our interview with Carrie Rheingans in Michigan, talking a little bit about the Abdul El Sayed victory, but also about her own work, which is really, really badass, trying to put pressure on the federal government to pass Medicare for all through the states.
Oh, that's awesome. Can't wait to hear about that. I still have family in Michigan, so let's get some Medicare for all for Michigan.
All right. And for the Goldberries, is that their name?
Hillberries, but you were really, really close.
It was way closer than I thought. Yeah. Okay, great. So Hillberries, wishing you universal health care. Have a great time, folks. Thank you so much, Ben. It was great to see you again. And here's my convo with Carrie. Hello, y'all. I'm Jillian Mason, and I am here with a friend from Michigan. You might be thinking about Michigan already this week. The national political media has been in a frenzy about friend of the pod, Abdul Sayed's Senate primary victory in Michigan. Sayed made Medicare for all the centerpiece of his campaign, and at the polls, over 700,000 Michiganders got behind that vision of healthcare justice. But there is another Medicare for all story that's unfolding in Michigan right now, and that's the campaign to win a statewide universal healthcare system in Michigan as a stepping stone to national Medicare for all. So Michigan State Representative Carrie Rheingans is leading the charge for national healthcare and for universal healthcare in Michigan, and she's organizing with state legislators across the country who are tired of waiting for the federal government to take action. So today she's going to tell us about her work in the Wolverine state and the 50-state strategy to introduce state-level Medicare for all bills in every state in the country. How are you today, Carrie? Welcome.
Thank you. Thank you so much for having me on. I've been a long-time listener, first-time caller, I guess you could say. And I am finally recovered from staying up till all hours waiting to hear whether Michiganders want to vote for candidates who are explicitly running on Medicare for all. And the survey says, yes, they do.
Hey, this is good news for everybody. Everybody. Yes. Yeah.
Everybody who needs healthcare, right?
Everybody who needs healthcare. Man, you are a listener. I love it. So just for folks who have not been taking notes at home yet, so Carrie is serving her second term. She's representing the 47th House District in Michigan. She grew up in a rural town in Michigan where her great-grandfather was a Presbyterian minister, deep Michigan roots. She also earned a Bachelor of Science, a Master of Public Health, and a Master of Social Work, all from the University of Michigan, of course. And before... Sorry, say again.
Go Blue.
Go Blue. Blue. Yeah. Is that your team? The Blue?
No, we're the Michigan Wolverines, and our phrase that we say to cheer for ourselves is to say, go Blue.
That is really cool. I went to a non-sports school. I went to NYU, and our sports team was the Violets.
So yeah, that's really cute.
It was like,
but it's really fun around election season when we can say, go Blue, vote Blue.
Oh, God, that's really good. A sports tie-in with organizing is always really, really, really effective. Yeah. So I forget what I was going to say. Oh, before you got elected to office, you were a project director for the Michigan Public Health Institute and a lecturer at the U of M School of Social Work. And you live in Western Ann Arbor with your husband and a 9-year-old daughter. Hello, 9-year-old daughter. Just saying hi. You don't let your kid listen to this podcast, though, right? I hope not.
She would not choose to listen to it, but she has heard parts of it when we listen to it in the car.
Oh, boy.
She wants everybody to have healthcare for all, too. She woke up yesterday morning all excited. Mama, did Abdul win?
Oh,
yeah, we got to finish counting all the votes because we want to make sure every vote counts. And so when she got home from camp yesterday, that was the first thing she asked when she got in the car because she knows one of his daughters. They're about the same age. So we live in the same town, right?
Oh, right. I keep forgetting that. Yeah. Michigan just seems like a really big place that's really far away to me. It's funny when y'all know each other.
Yes.
Pretty great. It's pretty great. So, I mean, why don't we actually start from there, from Michigan? How did Michigan become such a hotbed of Medicare for all activism right now?
Well, I have a theory, actually. So obviously everybody around the world knows Michigan's the state that put the world on wheels. And as soon as we started building cars and needing really, hard workers and skilled workers, and started really building up that union effort and saw the amazing work that unions can do to win great benefits for their members, healthcare became a huge thing that everybody started to notice in Michigan. Yeah, we want good healthcare. And I think the rise of unions and bargaining for healthcare as a employment benefit really helped put healthcare on the map here in Michigan. And now we, as Michiganders, are very protective of our access to healthcare. And so for decades, our senior John Dingell in the U.S. Congress introduced healthcare legislation, one bill of which was the precursor to Medicare itself. Mm-hmm. And then his son, John Dingell Sr., who was the dean of the House, he introduced single-payer bills for decades and decades. And when he retired, and his wife, Debbie Dingell, who is my current congresswoman, and I work closely with her, she picked up Medicare for All bill and she ran with it. John Conyers, the congressman from Detroit, also was a strong supporter and introduced single-payer universal healthcare bills. So honestly, we come by it here in Michigan to be strong supporters of the healthcare industry and delivering healthcare for everybody who needs it. In the state legislative level, in Ann Arbor, there was actually a legislator that introduced a statewide universal healthcare bill in the 90s. And then in the 20-teens, my predecessor, state representative, now mayor-elect for city of Ann Arbor, is Yusuf Rabi. He introduced a single-payer bill called MyCare. So I have picked that up here in Michigan.
Oh, nice.
Universal health care for all Michiganders. So we do come by it honestly. And this competition between state and federal, hey, I mean, it's one we all want to win.
Yeah, I mean, I think we should be clear, right, that Carrie, you believe in Medicare for all for everyone in the country, right?
Yes, I do.
It's just a question of how we get there, right? And in Canada, as folks know, right, in Canada, things started out in Saskatchewan. They managed to create a universal healthcare system there, and that managed to spark the entire country. So that's been one of the models, right, that you and the folks you've been working with have been looking at. Yeah, absolutely.
Yes, and honestly, it would be better because when I've been doing Medicare or these MyCare town halls across the state for 3.5 years now. I've done over 24 from peninsula to peninsula in Michigan. And I do say in my town halls, listen, I would prefer this at the federal level because one of the number one questions we get is, especially from the people who live in the Upper Peninsula, which in Michigan we call them Yoopers, the Yoopers who live on the border with Wisconsin, it's quicker for them to just go get healthcare in Wisconsin. So if they have a state level universal health insurance like MyCare, does that cover them in Wisconsin? Well, you know what would solve that is freaking national Medicare for all.
Yes,
so I would really like to have the Medicare for all platform rolling out across the country. But if they can't get it together at the federal level yet, let's test it out in a state like Michigan, a state like Texas. Those states are big enough to have a risk pool to make this work.
Right.
And I'm happy to talk more about conversations across state lines and with other state lawmakers about what our comparing and contrasting has been in these past couple of years about state level.
Absolutely. Well, we're going to get to that in a minute. But before we do, so you just personally, right, you've committed your life to health equity, right? First, you're a public health expert. Now you're a public health expert and a politician. Tell me, how did you come to that calling? How did health become your issue that you care so passionately about?
Well, the quick story is that when I was a middle schooler, I read Jurassic Park, and I thought, how the heck would you use this genetic engineering technology to make a dinosaur that can eat us when we have millions of people, kids around the world starving? Why don't we make a food that is cheap that has all the nutrients? That's middle school Carrie, what I wanted to do. Nerdy Carrie wanted to be a genetic engineer, and I went to genetics camp in high school. Yes, it's true. And then I went to college.
No, wait, hold on. I'm sorry. There's a genetics camp and you went to it.
In the late 90s, there was a 1-week science camp that my high school biology professor put on where we learned how to make recombinant DNA in E. coli bacteria. And we learned how to grow it and see if there was different, if we could tell the differences between the recombinant bacteria. Anyway, by the time I got to college, I started working in a lab and realized I didn't actually want to do those techniques in a small kind of lab the rest of my life. But I was getting really interested in, my science classes that I was taking, and I took an immunobiology class. And I learned about this virus called the human immunodeficiency virus, which attacks the very cells that are supposed to kill it. And I thought, that is freaking smart. This isn't, it was an interesting scientific marvel. But then I started learning in my social science classes about how HIV affects certain populations more than others. And it's because of systems and policies that were put in place that put people more at risk.
Yeah.
People who are living in poverty or that have racial discrimination against them in their day-to-day lives, or gender discrimination, those folks have behaviors sometimes that put them more at risk of contracting HIV. So I ended up shifting to working on HIV and AIDS for over a decade in undergrad and grad school, and then dedicating my life to fighting health disparities, which are put in place in the first place and perpetuated by these policy decisions that folks make at the top. And I want to make sure that the people making these policy and funding decisions actually understand the impacts of them. So to me, every policy issue is actually a health issue in my mind, because every single thing you do affects.
You have that great line in your bio. Rep. Rheingans believes that every policy issue is a health issue. I actually had highlighted that. I love that so much. Tell me more about what that means to you, and like how you approach that philosophically as someone who's trying to actually make laws.
Yeah. So, I mean, think about it. I live in the Great Lakes state. We're surrounded by 20% of the world's fresh water right here in Michigan. So our decisions that affect water runoff from cities, water runoff from agriculture, that affects our Great Lakes. And the Great Lakes is the source of drinking water for millions of people in our country. Right? So if you don't have clean drinking water, you're going to have bad health, and you could even die. I mean, let's look at the poop lettuce situation going on. We've had 2 people die of that in Michigan. And so we need to make sure that we have clean water, right? Ask the people of Flint. They just finished replacing the Flint water, the pipes with the lead in it. But the kids that got exposed to lead a decade ago, they're going to have those developmental issues their whole entire life. And that sets on a life trajectory, right? So that was a policy decision that enabled that poisoning of the whole city of Flint to happen. The state of Michigan under Republican trifecta allowed for emergency management of municipal jurisdictions. And that's what allowed the municipality's emergency manager to poison the kids of Flint. That is going to be affecting them for the rest of their life. So that's water alone. What about clean air? What about our food system and our food sources? Okay, those are all things that are very easy to tie to health, but what about the safety of our communities? Not only for people being able to get physical activity, but active transportation methods to get to and from work, to get to and from school. What about the amount of money families are making? We know that one of the most tightly correlated things to health outcomes is your income. And if you have a higher income, you tend to have better health outcomes. And so how do we make sure that we're making policy choices that allow families to move up that income ladder and have stable employment that pays enough? So all of these things to me, jobs, water, community safety, all of these things are related to health in my mind. Now, people who work in public health, bless their hearts, they call it social determinants of health. It's a very jargony word, but if you can talk about it in a regular way, regular people, they get it. They want their public servants and lawmakers to make decisions based on data, not vibes, and data that shows how it's going to improve our health and make us healthy enough to live the life we want to live.
Yeah. And I mean, we increasingly live in a time when people lie about data a lot, but I think that people on the ground, as you suggest, they know whether the data is true or false because they're fact checking it against their everyday lives, right? So when Trump tells me that, like, you know, I don't know, medicine is 600,000 times more affordable now or whatever, I'm like, no, actually, here is my bottle of Prozac and it is very expensive, you know? So I often think that like state legislators are actually like really, really close to their constituents in a way that federal legislators aren't. So it's really exciting that you get to go.
And I mean, that may be true for some federal legislators. I will say my Congresswoman, Debbie Dingell, you turn up at an event any given weekend in our community, she's there. So she's definitely on the ground hearing from folks. And when she gets back in DC, she lets them know what she's hearing on the ground. So I really appreciate that from our Congresswoman.
Yeah, we love working with Debbie Dingle. We love working with her office. She is just really, really feisty and awesome in such a great way. She's just so direct about
Yeah,
exactly what she wants and no bullshit about it, you know?
yeah, it's great. I love having her as my congresswoman.
It's pretty sweet. It's pretty sweet. I would trade you for mine. Yeah, that is great. So tell me a little bit more about the actual Medicare for All or single payer healthcare bill in Michigan that you, I believe, reintroduced, right?
Yes.
And then tell me about what it does. I know it makes sure that everyone gets the healthcare they need, but
Yeah.
what other kind of stuff is included? And yeah, and what was it like introducing that? And you know, how have your constituents and colleagues responded? That's a lot of questions. All at
Yes,
once.
it's totally fine. This is
Answer
literally
any of
my
them.
favorite thing to talk about in my job, and I do 90-minute town halls on this. So I'm going to condense a lot of this into like 2 3 minutes. So my care in Michigan, we call everything my something, right? Because that's our
Yeah.
abbreviation.
Oh,
So
for
my
those of
care,
you who are listening and not watching, she is holding up a little My Care brochure that has a cute little
yep. So
picture.
MI care, my care, since Michigan's abbreviation is MI. So my care is a bill that would establish the My Care Trust Fund into which we would put federal and state dollars to cover the medical necessary costs of care for all 10 million people living in Michigan. If you've lived here for 6 months or more, you're eligible for My Care. If you're born less than 6 months ago, you know, you get a special coverage, right? So you have to prove that you've lived here. So my care would have no copays, no deductibles, no monthly premiums. We do need federal approval in order to use federal dollars for this. We get billions of dollars from Medicare, Medicaid, Children's Special Healthcare Services, and the premium tax credits for Affordable Care Act plans here in Michigan. We would need federal approval for all of those dollars to be put into the My Care Trust Fund. We do ask for support for the state-based Universal Health Care Act, SBUHCA, which is a bill that has been introduced repeatedly by Congressman Ro Khanna from California and Senator Ed Markey from Massachusetts. They introduced it last summer again, and I was there in DC helping argue for the need for this state-based Universal Healthcare Act to allow for the federal waivers and federal approval. It would force the federal government to approve these kind of state-based plans. And we actually had a handful of other state lawmakers there arguing the same. So
yeah, we're definitely endorsers of that legislation, and think that it's so it's so important to attack these folks from all angles, right?
yes,
The healthcare
exactly.
system. It reminds me a little bit of, and I'll digress for a moment here, but I promise I'll bring it back. But it reminds me a little bit of when I was working with unions. I worked with some trade unionists from South America, from Brazil. And their union had been founded in like a coal mine. There were Molotov cocktails involved. They were fierce. And so they told me what they had learned about organizing about the pulpo. The pulpo is the octopus.
Yes.
And I think they had learned this from organizing against United Fruit, but they basically said, you know, if you try to catch an octopus by the leg, it'll just drop that leg and actually just like swim away. Now, I don't know if this is correct science, so just don't correct me. This is a metaphor. I don't know. Now that I know you went to genetics camp, I'm really nervous about how much you know about science. Anyway, so if you try to get that octopus by the leg, it'll go and it'll just like swim away. It'll drop that leg and swim away. So what you have to do is you have to catch all the legs at once and then bash it over the head with a hammer.
Yeah.
And I think that, you know, that's one of the things that we're doing here. We're fighting at the federal level. We're fighting in our communities. We're fighting against the insurance companies. We're fighting at the state level, right?
Yeah.
We need to get them by all the legs so that people see that, you know, this is something that we can actually control and change. So.
Yes. Yeah, that's a great metaphor. We do have to take all the paths right now because one of them is going to eventually work out and it will only make the other paths easier. I agree that the pulpo idea is a good one for us to just full court press here to mix metaphors. My care also is pretty comprehensive coverage. So we happen to believe that your brain and your eyes and your teeth and your ears are all part of your body. So they should all be covered by my care. So
even your luxury mouth bones.
Yeah, your luxury bones. Yeah, Senator Rivera from New York. I've talked to him and I've heard him say that on some panels. I love when he says that. Got to cover those luxury bones too in your mouth.
Yeah.
And then the one way that we build efficiency into our program here in Michigan is that we tie our service rates to Medicare rates. We put in our bill that it's 150% or 1.5 times the rate that Medicare pays. Most providers across the state, when I'm doing these town halls, when they hear that, they are happy to hear it, especially dentists. So that is a way that we don't have to do that actuarial science and figure that out. We tie it to a federal rate. We do the same for devices and prescriptions. We tie it to VA negotiated rates. So that way, providers and pharmacists and others, they know how much they'll get paid for those kinds of services and devices. We also are very focused on the governance. My bill is a policy bill. In Michigan, our policy and appropriations bills tend to be different bills. And we are outlining the parameters of the policy, establishing the fund, how is it governed? We propose a board that has some, depoliticizing factors built into that. And then the funding and financing mechanisms, like I said, federal financing and state financing. Our state constitution actually has written into it a flat tax, and graduated taxation is not allowed. So we do need to change our state constitution, which also does not faze me because we have done it so many times recently, codifying abortion rights into our state constitution, expanding voting rights drastically here in Michigan, making an independent redistricting commission. So we have experience doing that, and we have volunteers standing by for us to activate should we want to activate them soon. And I think we may be working on that in the next couple of years here. So we are going around the state. When I first got elected in 2022, I came into Lansing with a Democratic trifecta in 2023 for the first time in Michigan in 40 years. So I was, of course, freaking pumped to introduce Michigan's state level single payer bill. And I was actually told, please don't introduce that. Please don't do that, because we don't want people to say that Democrats want socialized medicine. And that's when I realized, even Democrats don't understand that single payer is a way of paying and financing healthcare. It's not, taking over the entire healthcare delivery system. Right. People don't know the difference. They think that insurance is delivery. Now, payment drives delivery in the United States, but it is not the same thing as delivery.
When you say, can you just repeat that? Because I think that's a really important point. Payment drives delivery, but it's not the same thing as delivery. Can you just explain that? Yeah.
Yeah. So the healthcare services are complex. Healthcare delivery is done by highly educated people who have to be specialized and have a lot of experience, right? That is not just something that you can shop around for and that you can just pay out of pocket for. That means it is expensive types of high skill care. And so that's why we need help paying for it. That's why we have created insurance companies in the first place. We need a third party to pay for this, because me as a patient paying for that experienced care, that is expensive. Not only that, I'm too dumb to know the difference between this ologist and that ologist, right?
Sure. So
how am I supposed to know which ologist I need to go talk to for which thing part of my body is wrong, it is not even reasonable to expect the general public to know how to quote unquote shop around in a market, right? So that's why I think we need to change how we pay for our healthcare, because the general public is not supposed to be educated enough or have enough time to shop around for these kinds of services. And the people who do these services, they have to invest a lot of time and money into getting specialized and understand what they're doing. So they deserve to be paid well. So I think, in the way that we've been delivering healthcare in the United States, the way it gets paid for does drive delivery, in the fact that healthcare delivery systems and hospitals and providers prefer patients with certain medical coverage because it pays more or it covers more things. So I think that payment does drive how people get their healthcare delivered, but it is not the only factor and the only thing driving delivery. So if we change how we pay for healthcare, it can change how healthcare is delivered. But with my care, with Medicare for All, this would just change how we pay the providers and pay for the services and the devices and the prescriptions. And it would not make all of those providers be state employees, right?
Right.
The only thing it
Right.
would do
Right.
is make everybody administering my care the state employees. We're trying to make this publicly financed, publicly delivered, so that there's
I
no
see.
private profit motive, private profit benefit, right?
So there would be like the My Care agency, and that would be like part of the state
Yes.
government and
Yep.
regulated by the state government, and people would be able to hold accountable like the state government. Yeah.
Correct. And in
Mm.
fact, in our bill, we wrote in, since we know that my care will be such good coverage for such cheap of a cost compared to what people are paying now, probably we won't need very many private insurance companies in Michigan, if any at all. So all those people are going to lose their jobs. But in my care, in the bill, we wrote in that they get preferential hiring because we actually are going to need their experience on how to process claims and how to work through contracting and things. Now, one thing that's not in the bill that we need to add to the next time is that anybody as a provider or a facility that's licensed in Michigan, if our state licenses you, you should be part of our network, right? Right now, one of the biggest problems people have is, are you in network or out of network? Or when you're going to the hospital and you get anesthesia, you don't know that that particular anesthesiologist is out of network. How are you going to know when you're freaking under anesthesia? You can't shop around. So I think if we license you in Michigan, that means we think that you're good enough to be licensed here. So we should think that you're good enough to be paid by our state My Care program. So that simplifies contracting and paperwork and getting impaneled for providers as well.
So this all sounds very sensible. I worry that it's too sensible for the American people. No, it's not. Nothing's too sensible for the American people. They deserve something sensible right now.
Correct.
So you said that your colleagues were like, "Oh, please don't introduce this," before you introduced it. But how's the response been since you actually introduced this bill?
Well, we've had almost half of our Democratic caucus in the House co-sponsor it last term and this term, and it'll be an even bigger percent next term. We've never had a bill introduced in the state Senate here in Michigan, and I think that's going to change next term. There's a chance that Michigan has another Democratic trifecta, and if we pass the policy bill that we have been introducing and improving the last two terms, and we'll improve upon it again next term, like I just said, I think that there will be a lot more support from the general public. And if we can pass it, it still depends on federal approval, which if we get a Medicare for All or State-Based Universal Healthcare Act supporting president in 2028, 29, then we can get that approval and test it out here in Michigan. We have 10 million people here. That's a big enough pool to test it out. Compared to some of my other colleagues in other states, for example, I've talked to folks from Colorado and Maryland, and each of them have about 5 million or so folks. So they're wondering, is this like the edge of this being possible? Can they work with states nearby to work on this? The folks up in New England and Connecticut and Rhode Island, Vermont, New Hampshire, they're talking about, is there a way to make like a regional consortium to have a big enough risk pool to try this out? So these are things that we are considering while we're waiting for the federal government to get it together. Right now, we know that this federal administration and Dr. Oz, famous TV personality, is not inclined to approve state level plans. But if we introduce a bill in every single state in early 2027, that's when the presidential primary is really going to start. I mean, it'll probably start here in November, December.
Sure.
But if we introduce
tomorrow.
a bill in every state in early 27, those candidates are going to be asked about it. They're going to have to talk about it. They're going to be asked in every state, would you support the federal legislation to allow this to happen in our state? And we're going to have to force this as a conversation. And that's part of why I am pushing to make sure that we have a bill sponsor in every state. Right now, we have just under 24 states, just under half of the states that have some sort of movement or a commission or something. But we need a bill in every single state so that every single place that any presidential candidate goes, they're going to be asked about this.
Oh, I love that. You're so right, though, that does, in addition to actually putting real political pressure on it, right? It also does create that kind of pressure to answer, right? That pressure to respond. And in that pressure, I think a lot of people find that they don't have as many complaints as they thought they did. And the other thing that it does as well is highlights the difference between Democratic candidates who actually are trying to solve the healthcare problem, whereas Republicans and Donald Trump are trying to exacerbate the problem. They want to rip healthcare away from millions of people so that they can give that money to their billionaire buddies. And that is what they have been doing.
it will only continue to get worse. I've been telling people across the state that I think our healthcare system is going to collapse completely in the next 3 to 5 years. And as that is happening, it looks like hospitals closing. It looks like clinics closing. It looks like millions of people losing coverage. It looks like a big debate that we just had recently in my community. One of our local hospitals couldn't come to a contract with their nurses as well at the same time as with their largest insurer in the state of Michigan. So this one local hospital was like, what do? We can't get a contract with the people who pay us or the people who work for us. That is what it looks like to have the healthcare system collapse. Fewer and fewer of these contracts will be signed. People will be left out of healthcare access. And that is very dangerous. And it touches each and every one of us across the entire country. Democrats are trying to solve this problem. Republicans are trying to exacerbate it.
Yeah, absolutely. It's a fucking death cult at this point, and it's shocking that they think of themselves as the party of life, because they have so little respect for human life and dignity that it's just maddening and infuriating. Okay, rant over. I did want to talk about this 50-state strategy stuff, because I think, when we talk about organizing, right, we generally are talking about like, I'm going to go out on my block and I'm going to knock on my neighbors' doors and organize with them. But we don't actually thinking about organizing the politicians. And that's what you're working on. And you're organizing with your peers in other states in the country to sort of try to achieve this 50-state strategy, and also to exchange best practices and that kind of thing. Tell me more about that collaboration. What has it been like organizing the politicians, and why is that something that you kind of like came to understand as a necessity?
Yeah, so I actually, in my world of HIV and AIDS work, I mostly was an organizer. I did on the ground service delivery, but then I started doing policy advocacy and organizing in my local community, across the state, across the country, and even at the International AIDS Conference, I did some organizing there. So organizing comes to me naturally, and I actually taught it at University of Michigan School of Social Work. So to me, when I got into the legislature and I saw that we needed to work together and have collective action to move certain things, I was like looking around like, why are we not just automatically doing this and just relying on outside organizations? And I said, why can't we be the ones organizing ourselves? So that is true for so many policy issues. But what I focused on is my care. And last term, I really started putting the feelers out. But in 2025, when I was in minority now in Michigan, in the Michigan House, it's Republican controlled. We have a little mini Trump who is our speaker, who's just not going to do anything good for people. Only the billionaire DeVos family here in Michigan. Yes, that's Betsy DeVos, former.
Oh, I forgot that you've got her. What fun.
Yeah, and all of the rest of them, all their yachts on Lake Michigan. It's disgusting. So they're pouring in, millions of dollars to try to privatize everything in Michigan so they can buy it up and benefit from it. But I refuse to go that way. And I think organizing across the state by getting boots on the ground, talking to folks in every corner. Michigan's Democratic Party has one of the first rural caucuses in the country. And so they were one of our early supporters of my care. And so I've been doing these town halls at libraries in the winter, right? I had to drive up to parts of Michigan in the snow, and I was in Michigan's Upper Peninsula in October the last couple of years, and doing town halls up there. People want healthcare. They see their rural hospitals closing. They know that this will stabilize their access to care, and it will bring families to their communities and make sure that they have ongoing care. So organizing here has shown me, I need to actually learn from my colleagues in other states. It's been great comparing and contrasting some of the other states that have done certain studies or created certain commissions. We've been sharing best practices across state lines. For example, the Pennsylvania bill that was just recently introduced leaned heavily on other state bills that, they talked to about what to include in theirs. I'm already in conversation with an incoming representative in North Carolina who ran on a state level single payer and unseated a 30-year incumbent because he was talking about what people want. And now he's going to be introducing that bill, and he's trying to figure out which state that already has a bill should they model it on. So this has been really beneficial for us to compare and contrast. And then there's a couple bills that could be models just for other states to almost copy and paste and ask their bill drafters to, modify it for their own state. But a lot of our states that are in the Mountain West, the Plains area, and the South have not yet introduced a bill. And we need help reaching legislators in those states who would be willing to be their champion. We need a Texas champion, if you know anybody.
Absolutely.
And then, of course, we have folks in the Deep South. We need somebody in Georgia. We do have bills in Florida. So that's what we're trying to do, is just coordinate the introduction of bills in early 27 so it can be a national splash. And we've been in contact with Congresswoman Jayapal and Senator Sanders, who are working with my Congresswoman Debbie Dingell on the National Medicare for All strategy. And we are trying to coordinate as much as possible to make this a salient issue in the 2027 and 2028 presidential primary, along with folks from the Working Families Party, Physicians for National Health Program, y'all, Healthcare Now.
Hello, Healthcare Now. Yeah.
The national group called One Payer States. They're really working on this state-based strategy.
Shout out to our friends at One Payer States, who are a collection of folks from different states working on single payer within their states. We love you guys. And really excited that that's been a network that you've been able to tap into. And
they've been pushing that state-based Universal Healthcare Act for years and years now. So,
awesome.
With our forces combined, somebody's going to win this fight for healthcare for everybody. And then once Americans see it happening somewhere, they're going to demand it in their own community. And the appetite now has been stronger than it has ever been before, as the healthcare system is collapsing, as the one big bullshit bill is destroying people's lives and livelihoods and our whole country, frankly. I think people are demanding it more and more. We're seeing polling, national polls show 63-65% of people support specifically the phrase Medicare for all. And when asked if it raises your taxes a little bit, might you still support it? Still 63% of people say yes.
That's
Here
right.
in Michigan, we had a group poll Michiganders, and 58% of people want a state level Medicare for all style program. So the people want it. More people are only going to want it over time as they start seeing all their clinics and hospitals closing around them.
That's right.
And I think now is the moment that we have to seize. That is why Michiganders chose Abdul El-Sayed to send to the United States Senate. He's going to be able to defeat Florida Mike Rogers, who is a former pharmaceutical lobbyist. I mean, this guy only wants to enrich himself the same way Donald Trump is. He sees Trump bucks coming in and he just wants the same thing, right? So
doesn't he live near Mar-a-Lago or something now? Or?
He does. He has a house close enough that he can lick all of Donald Trump's boots if he wants. And I guess it worked because he got his endorsement. And I'm telling you what, Mike Rogers, Donald Trump, same feller. It's the same thing with our governor candidate here in Michigan, sucking up to try to get that endorsement. Donald Trump has a 33% approval rating in Michigan. Like, come on, this is not a good idea for them. Well, whatever. I'm happy to see them burn out. And in the meantime, we'll just be here, keeping our head down, talking to our neighbors, talking to our colleagues, and trying to win healthcare for everybody in Michigan and everybody across the country.
Beautiful. I fucking love it. That is amazing. I just think, I think Michiganders are smart. And when I think about Michigan, I think about people like you and Abdul and Debbie Dingell, just like kind of no bullshit, face forward fighters ready to go. And y'all are really proving that you're ready to go on Medicare for all. So that's awesome.
Yeah, we are. And it's just going to take the work of all of us together to get this over the finish line. And it's a fun competition to see who will get there first.
Yes, absolutely. And I'm sure that there is a market for it on some kind of online betting app, but maybe we don't get involved with that yet.
Oh my God. I do not participate in manipulating the markets for my own game. Get out of here.
I love hearing that from a politician. That was just a test. Thank you so much, Carrie, for being here today. I also want to thank our podcast team, especially our audio editor, Craig Stanton. I want to remind folks to like, subscribe, and comment and share with your friends. This podcast is a project of the Healthcare Now Education Fund. You can support the pod by going to www.healthcare-now.org and clicking on the donate tab to send us some love. Carrie, thank you so much for being with us today.
Thank you so much. I appreciate being here. Can't wait to hear the episode and share it to the 4 winds.
Sounds great. Thank you, everyone, and stay safe and stay dangerous.